Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks if I could talk about the situation with Jordan Peterson going to rehab, and specifically about the drug at the center of this situation called Clonazepam. So some important disclaimers here for this video. I'm not diagnosing anyone, only speculating about what could be happening in a situation like this, and my speculations are only based on the evidence that's available, which, as far as I can tell, is in the form here of a video that his daughter posted on YouTube, that Jordan Peterson's daughter posted on YouTube. Also, I'm a counselor educator, a licensed counselor, and a licensed chemical dependency professional. I'm not a psychiatrist or physician of any kind, and I'm not a prescriber of any kind. So, a summary of what's going on here. We see that Jordan Peterson is a famous mental health professional. He's popular on YouTube. He's popular in general. And he's technically a psychologist who's authorized to practice in Canada. So he's either licensed or he's the equivalent of licensed. In Canada, I think it's based on the province, and they have certification, registration, and licensure. So, again, the equivalent of being licensed if he's not licensed. Now again, all this is based on a video posted by his daughter on YouTube. We see that Dr. Peterson's wife, Tammy, became very ill. Her life was in danger, and she was treated for quite some time by a number of physicians. From what I understand now, she's doing much better, which is very good to hear. But at the time, when everything was uncertain, before there was much in the way of good news, we see that Dr. Peterson was prescribed medication, specifically a medication called Clonazepam. And he took this medication to help with the symptoms that he was experiencing dealing with his wife being ill, which of course is completely understandable given the circumstances. Then we see that some of the concerns here with his wife were alleviated. Like I mentioned, she seems to be doing better now. So he attempted to stop the Clonazepam, had withdrawal symptoms, and checked himself into rehab. So this brings up a lot of questions. And many of these questions are not really specific to Jordan Peterson, but rather they're around the idea that a mental health professional could use Clonazepam and then go to rehab. So how can this happen to a mental health professional? Well, some important things to keep in mind in this situation. Jordan Peterson was lawfully prescribed the medication for a valid reason. So we're not talking about illegal drugs here. He attempted to stop cold turkey. Now, we don't know if he was advised to do this or not, but I would be surprised if a physician told him to do this, because stopping benzodiazepines quickly can lead to death under some circumstances. It can be very dangerous. We see he experienced unpleasant symptoms. We really don't know exactly what those symptoms were. And he voluntarily checked himself into rehab. And I think the operative word here, of course, is voluntarily. He was not forced to go. So back to that question. How can this happen to a mental health professional? Well, in my experience, I have not seen the fact that somebody is a mental health professional of some type as highly protective against this type of situation, especially when the medication is being taken legally for a valid reason and somebody attempts to stop suddenly. Some people have said that Jordan Peterson should have known better. He should have known the dangers of Clonazepam, its potential to become habit-forming, and the dangers of trying to stop quickly. Maybe somebody with Jordan Peterson's background would have a better probability of knowing the dangers. But again, in my experience, I'm not surprised at all that this happened to a mental health professional. During my career as a mental health counselor, I've seen or heard of this happening dozens of times to other mental health professionals. I think there are a few important factors to keep in mind in this situation. First, believing that you will lose your spouse is extremely stressful. It's an extremely stressful set of circumstances. Not just a little stressful, not just moderately stressful, but extremely stressful. Second, sometimes individuals take medications like Clonazepam because they have been told by a physician, or they otherwise believe, that the benefits outweigh the risks. And in many situations, the benefits do outweigh the risks. I don't see anything unusual about this. If somebody had a bad outcome from a surgery that had a low risk of bad outcomes, nobody would say, why did they have the surgery in the first place? When people receive treatment, they take risks. There is a risk associated with not receiving treatment and a risk associated with receiving treatment. So this addresses why somebody would take Clonazepam in the first place. But of course the other question here is why did he attempt to stop cold turkey? And just for the sake of argument, I'll run under the assumption that he was not advised to do that. So I think this really speaks more to the dangers of clonazepam than to the idea that somehow he was missing something obvious. Again, mental health professionals don't necessarily get a lot of training in psychopharmacology. For most mental health professionals, there's an emphasis on psychopathology, talk therapy treatment, appraisal, personality, not prescription medication. Even when mental health professionals are trained about addiction, there's a lot of emphasis on illegal drugs and alcohol, but not on prescription drugs. Now, clonazepam is an interesting medication. It's also marketed under the name Klonopin. Clonazepam is a benzodiazepine. Benzodiazepines reduce the activity of the nerves in the brain and spinal cord by enhancing the effects of a neurotransmitter called GABA. Other well-known benzodiazepines include alprazolam, also known as Xanax, diazepam, also known as Valium, and lorazepam, also known as Ativan. Now, clonazepam has a fairly long half-life. That's the amount of time it takes for half of the drug to leave somebody's system. I'm kind of simplifying that a bit, but that's generally what it means. A half-life is dependent on a number of variables, including individual differences, but in general, the half-life of clonazepam is thought to be between 18 and 50 hours. Xanax has a half-life of 6 to 12 hours. Ativan has a half-life of 10 to 20 hours, and Valium actually has a longer half-life than all of them, 20 to 50 hours. Clonazepam and all of the benzodiazepines are habit-forming, meaning they tend to lead to physical and psychological dependence. And the withdrawal symptoms are really horrible in many cases. A number of people who attempt to stop using clonazepam are shocked by how painful the withdrawal is. Now, I don't know exactly what symptoms motivated Jordan Peterson to go to rehab, but many people in this situation are motivated by the rebound anxiety and the rebound panic. So a common reason for taking clonazepam would be extreme anxiety and the presence of panic attacks, even though the drug can be used and often is used for other symptoms. What happens during the withdrawal for many people is that they have these rebound symptoms. The rebound anxiety and the rebound panic feel like the original anxiety and panic, but the rebound symptoms are much worse. They're more intense and have a longer duration than the original symptoms. Also, the triggers for the rebound symptoms may be different than the triggers for the original symptoms. Or they may come on randomly, whereas the original symptoms may have been more predictable. So consider the order of events here. We see these symptoms, which are really distressing, anxiety, and panic. We see somebody taking clonazepam or another benzodiazepine and usually feeling somewhat better. And then, when they try to stop, they have the rebound symptoms, which are worse than ever, the worst anxiety and panic they ever experienced. So it's easy to see why people are so upset and surprised by this pattern. It has a really horrible ending to it. Now, we see with benzodiazepines that we tend to see withdrawal symptoms come on fairly quickly, and they tend to build up for about 2 weeks. So at that 2-week mark, the withdrawal symptoms are usually as bad as they're going to get, but the symptoms subside very slowly over the course of months and sometimes even years. Not all the symptoms are related to rebound anxiety or rebound panic, of course. Those symptoms just usually stand out for people. They're noticeable right away. There are a lot of other symptoms associated with benzodiazepine withdrawal, including confusion, fatigue, seizures, nausea, dizziness, headaches, depression, loss of memory, insomnia, hallucinations, and many other potential symptoms. So some of these symptoms may dissipate early on in the withdrawal, and others again may hang on for a long time. What's confusing here for people is that it's not always clear on how to distinguish the original symptoms from the withdrawal symptoms. So when somebody stops using clonazepam, are they experiencing the original symptoms coming back? Are they experiencing withdrawal symptoms? Or are they experiencing symptoms coming from both sources? So would somebody in Jordan Peterson's situation have other options? Was there something else that could be done in the situation? Usually somebody can get off of benzodiazepines by tapering under medical supervision. The tapering schedule may involve gradually reducing the quantity of the same benzodiazepine. So if somebody's on clonazepam, they would reduce the amount of clonazepam they took for several weeks, like they reduce to one level and take that for several weeks. Then over the course of the next several weeks, they would reduce again. But there's also another way that tapering can take place. Rather than reducing the amount of the benzodiazepine that somebody is on, sometimes physicians switch them to another benzodiazepine. So for example, if somebody's dependent on Xanax, they would take a lower dosage of Xanax for several weeks. And again, just like I was talking about with the clonazepam, that dosage would go down for the next period of several weeks and so on. But with Xanax, another way would be to switch to a drug like clonazepam that has a longer half-life. So interestingly, clonazepam is sometimes given to people who are having withdrawal symptoms from other benzodiazepines. I mentioned Xanax. We also see it's fairly common for Ativan withdrawal. Both of those, Xanax and Ativan, have a short half-life. And of course, as I mentioned, clonazepam has a long half-life. For the same reason, Valium is sometimes used to help people withdraw from Xanax and Ativan. Again, Valium has a long half-life. So to kind of sum this up, I think essentially what happens a lot of time is that people underestimate the difficulties associated with benzodiazepine withdrawal. They may not know that you can become dependent on it. They may not know that there are withdrawal symptoms associated with the drug, or they may think that based on the quantity they've taken or how long they've taken it, that they'll have no problem coming off of it. This situation can affect anybody. Again, mental health professionals are not immune from dependence on clonazepam or any other drug, and they're not immune from withdrawal symptoms. I mentioned many times in my videos previously that even though I'm a counselor, and I believe in the effectiveness of counseling for many mental health symptoms, I recognize that for certain disorders and under certain circumstances, medications can be indispensable, which is why it's important for counselors and psychiatrists to work together. Clonazepam has been associated with risks, as I've talked about here in this video, but that doesn't mean it's not suitable under every circumstance. There are circumstances where benzodiazepines would make sense. For some people, a benzodiazepine like clonazepam may be the only medication that has ever been effective in treating their symptoms. My point here is that it's important to work with a psychiatrist or other qualified prescriber to identify which medications, if any, are indicated to treat specific mental health symptoms. And as always, work with a counselor as well. Psychotropic medications can be very effective at masking symptoms, which is valuable. A lot of times people say that like it's a bad thing, but masking symptoms can be very valuable. But the medications usually don't change the underlying cognitive, behavioral, and affective characteristics that can also maintain the symptoms. So I know whenever I talk about topics like clonazepam and withdrawal, there will be a variety of opinions. Please put any opinions and thoughts in the comment section. They always generate a really interesting dialogue. I hope you found this description of clonazepam withdrawal to be interesting. Thanks for watching.